1460 WVOX.
Now, live from Whitney Media, 1460 WVOX, The Greenberg Report, with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and my guest is Adria Gross. If you have a loved one who is very old and needs nursing home care, you would definitely be interested in this program, because Adria Gross has been an advocate for people who may be incapable of speaking, people who have family members who have died or are clueless what to say when they have problems with nursing homes and senior facilities. So, Adria, thanks so much for joining us, and maybe you could just tell us a little bit about yourself and your business.
Thank you for having me on, Paul, this morning. For those of you who have never met me or don't know about me, I grew up in Port Jervis and became very ill at the age of 11 and a half. I had an insect bite that put me in a coma, and I lived with epilepsy, averaging 18 seizures a month, 32 pills a day. This went on for about 25 years. Then I had brain surgery, left temporal lobectomy, and after that, my first job was, I did have a degree in education. They wouldn't certify me to be a teacher because it was before the 1990 Disabilities Act, but I wound up being hired by an insurance company, and within 2 weeks, they taught me how to deny claims. I worked for that insurance company for 2 years, and I went to another large insurance company that at the time was in over 130 countries. And again, they taught me how to deny. So that was 12 years there. Then I opened up a medical billing business, now I started an advocacy business 11 years ago. It's called MedWise Insurance Advocacy, and I save people millions of dollars annually. And
basically, now you're doing the opposite. Instead of denying claims, you're trying to advocate for seniors. Now, is this all medical insurance issues, or do you focus mainly on the elderly?
Well, I'm part of an organization called Orion, and we're in the New York area, and we help a lot of people throughout the New York area. We have a group in Westchester, Long Island, New York City, and Northern New Jersey. And I have to tell you, I'm honored to be part of them. I get quite a few referrals. But one of the major issues that I've seen happening when it comes to the seniors is, believe it or not, they have about 80% or more of people who turn 65 and go on Medicare, they go on a Medicare Advantage plan. The reason why this happens is because they think to themselves, oh my God, I can save all this money. I don't have to pay this money out for a Medicare plan that you get through the government. And then you have to have Part A, a Part B, and Part D. Part A is hospitalization. Part B is any other bills, like if you go to see the doctor. Even when you're in the hospital, the doctor sends the bills, that's part of Part B. And your Part D is medication. But if you have an Advantage plan, which goes under supposedly Part C, it covers A, B, and D. So the Part C is the Medicare Advantage plans, which are really awful when someone winds up in a rehab.
We're going to find out why it's awful and what people could do. I'm Paul Feiner, Greenberg Town Supervisor, and we're talking with Adria Gross. And there's many people who think that they are covered, and they really are not. And we'll tell you what to do if you or a loved one is facing that problem. And you could be kicked out of a nursing home or assisted living facility or rehab facility. So we'll find out and give you some tips. This is a really important program for many people who have elderly resident family members, or they're elderly themselves. I'm Paul Feiner, Town Supervisor.
Now, back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and we have a very important program today because there's a lot of people who have elderly family members. They may be elderly. They take out policies that they think are going to help them if they need a nursing home or a rehab. And then after they're accepted into the rehab, their coverage could be denied. So, Adria, is this a common problem?
Yes, it is. And one of the things that everybody has to know is even when you're in the hospital and they're going to send you to a rehab or a nursing facility before you go home, you have to have 3 midnights as an inpatient. If you don't have those 3 midnights as an inpatient, Medicare's not going to cover you.
So if you stay for like 2 nights, then you don't get, and they say, oh, now you have to go to rehab, you don't get coverage.
That's right. And it's 3 nights as an inpatient. You cannot be an outpatient under observation. You have to be an inpatient.
And do a lot of people get the coverage denied? Have you?
I've seen that happen where, that nursing facility or rehab is going to bill the patient because they were never informed in advance that this is what was required by Medicare.
Wow. What about people who have been there for more than 3 days?
Okay, so you've been there for 3 midnights, and now the hospital is sending you to a rehab or nursing home.
Say you're there a week.
Right. As long as you've had your 3 midnights and they send you off, you should be covered. But the issue has been the Medicare Advantage plans, which are owned by the commercial insurers. Our government pays money to the commercial insurers to offer this rather than going through direct Medicare and a supplement and a prescription plan. What happens is the nursing facilities are forced by the commercial insurers to push those people out, but they're not able to get back home. They might not be able to walk into their house. Let's say they have stairs. I see that more than anything else, that there's no way that they can go home. They don't have people to take care of them. You have a lot of single people who really don't have family and, they've never gotten married. I've seen a lot of this. And I've overturned cases. Look, the good thing about the Medicare Advantage plans, it's going to cost you less money. That's great. But the bad thing is that if you wind up into one of these rehabs or nursing homes, God forbid, they're gonna push you out early, but you have to fight it.
Why do they push you out early?
Because the commercial insurer is saying it's time for them to go home. They should not be there anymore.
Why would it be time for them to go home?
They're saving money. The commercial insurers are saving money rather than paying for you to remain there until you're really capable of going home.
So basically, the Medicare is a government program, but they deal with commercial insurers, and the commercial insurers basically have control over the process, and then they'll tell the rehab place, we're not going to pay.
Right. And I have been before judges already. One of the cases that I overturned was someone right here in Westchester. I'm a national company, but his bills were $24,000, and I just overturned another one that was $40,000. It has to, I always tell people, do not be scared. You've got to fight for your rights, and you really have to go after this.
How do you fight?
You have to get this, and this is what I always recommend people to do. They're going to request for the medical records, and then you have to get letters from your providers indicating why you were unable to go home. And that's the only way that I've been able to overturn those cases.
So why, let's say you don't have family members, is that a good excuse if you're a single person and you can't take care of yourself?
Well, you could have a family, but they might not live near you, and you don't have children who are able to move in with you. There can be so many reasons. And like I said, you have to fight, get the medical records, letters from the providers indicating why you couldn't leave. And very often, this winds up going before a judge. And like just yesterday, overturned a case. That case yesterday was $82,000.
Now, your company, what you do. How do people get? How do they pay you? And is it expensive hiring an advocate?
I often give them a choice. Like, listen, I submit bills for people because they can't. They're not able to do it. They don't have the time. Even intellectually, sometimes they can't do it when they get to an elder age. So when I handle those, I charge an hourly rate that we agree upon. Otherwise, a lot of my cases, when they have to be overturned, where they were denied out of network, there was no pre-authorization. Very often people ask me, we agree to a percentage because I'm going to work on the case. But if I can't overturn that case, then you owe me nothing. So very often they say, hey, Adria, let's do it on a percentage basis. I've been in Consumer Reports 4 times, and there was an article in there for a gentleman in northern New York who spoke exactly about this.
Right. If somebody wants to reach out to you, how do they do so?
My website is, my email address is adria@medicalinsuranceadvocacy.com. So you just go into www.medicalinsuranceadvocacy.com, and my email address is adria@medicalinsuranceadvocacy.com.
Are there other people doing similar things like you?
Yes, but I have to be honest with you. I belong to 2 national associations, and people who really understand this and know it, there's only about 50 of us throughout the United States.
Wow. And after this break, because we have another break, maybe you could give us specifics, specific examples of the horror stories that you've seen and what you've done and overcame it. Because I think that this is probably very common, and there's probably a lot of people who just are crying when they're at these rehabs and told that they have to go home. I'm Paul Feiner, Greenberg Town Supervisor.
WVOX. Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and today we have a very, very important program that I know will be of interest to many residents of Westchester who have elderly family members or who are elderly. So the issue is somebody has a Medicare gap, plan. They have an insurance plan. They go into a rehab after a hospital stay, and then they're told that they have to leave. And I thought this segment, we should hear some examples, some horror stories and what you did. So maybe, Adria, you could just tell us, as many examples as you can.
Thank you. I just also want to mention besides the Medicare Advantage plans, the other thing that I see happening out there, you have a long-term care policy. And a lot of times those long-term care policies can even help you pay when you're in a nursing home or a rehab, depending upon the amount of time. All the policies are a bit different. They have you have to wait a certain time period. But even when you leave that rehab or nursing home, you might be able to get coverage at home depending upon your ADLs. You have to have 2 ADLs. But
what's an ADL?
It's when you are incapable of going to the bathroom, feeding yourself, walking. There's like 5 or 6 different ones that you'd have to look at on your policy if you have a long-term care policy. It's very different. Sometimes your family can take care of you. Sometimes you have to hire an organization. And a lot of times when someone winds up in an assisted living facility or even to a higher level of care needed, a lot of times you can have people come in and take care of you through your long-term care policy. But the issue is, I've had cases where those are being denied also. So
Why would they be denied?
and because the insurance companies don't want to pay out. They were, when Obamacare started, they had to pay out at least 80 to 85%. You take a look and see how much money a lot of these insurance companies are making. It really bothers me that they're allowed to be on the stock exchange.
So if I basically get like a flyer in the mail saying, why don't you sign up for a long-term care policy? And every month I'm putting in some money. I think I'm taking care of myself, but in fact, I may be paying the insurance company, and if I ever need it, I'm not going to get the benefits.
That's right. I mean, I've had cases national where they're not paying out, and they will even have someone interview you in your home. It's usually a nurse who comes. Recently they've been doing it on Zoom, and they test to see if you're capable, if you're not. I have to be honest with you. Every case that I've had has been overturned. I make sure that people get what they're entitled to.
So could we have some more examples? Because
Yeah.
these examples could also highlight to people what they should look out
Right.
for.
So I just handled a case yesterday, and this person had a Medicare Advantage plan. What they did is she was here. She comes from out of state, and she went to a New York City hospital for a heart and lung transplant. So they said to her, "Look, we want you to stay here for a couple years, and we want you here for 24 months. So if something happens, you can come right over to the hospital and help." Now she had this amazing, fantastic plan through the government. It was one of the counties in New York State. And I went before a judge with them yesterday because what happened was they said, "Look, we'll pay for housing and transportation." I mean, you don't see this in most plans, but this particular one that she got a Medicare Advantage plan through her past employer was like unbelievable, the coverage. They paid the first 7 months, which was over $15,000 a month for her to stay somewhere in New York City. And then the following 5 months, which came to $82,000. They said, "We're not going to cover this anymore." So when I was on the phone with the judge, this is really incredible. I had sent them 5 emails with attachments. The judge never saw the attachments. And it was like a whirlwind. But he admitted when we were on the phone, and the insurance company was on the phone at the same time, which again was a Medicare Advantage plan insurance company. And it's overturned, and they're going to give the family the $82,000.
That's great. Now, could people sometimes overturn it themselves if they don't want to hire a company?
They don't know what to do. In fact, the judge said to me yesterday, "Are you an attorney?" I said, "No. I've been in the health insurance industry for 34 years, and I help people throughout the United States." So it's even hard because they wanted an attorney. I have to be honest, I'm not one. But I know how to help these people because of my years of experience in this field.
Great. Now, sometimes, say, if a rehab facility says they're going to kick you out, is the rehab facility, and somebody wants to meet with, say, the head of the rehab and says, and starts crying and getting very emotional, is the problem if you have an advocate in the rehab? Could they sometimes keep you there?
I have to tell you, that rehab sometimes doesn't even tell their people that they're going to have to pay. Like this one case that I overturned for 24 grand, they never told him. They said, "You know what? We're going to take you off of the Medicare Advantage plan and put you on direct Medicare." But they did not indicate to him that he was going to be responsible for $500 a day, which totaled out to $24,000.
Right, and did you?
I was able to overturn the case. It was a lot of fighting between the insurance company, and I also went to the state of New York, the AG, and this went back and forth and back and forth. Let me tell you, the nursing facility, rehab, did not want to provide the medical records. Okay, I was fighting with them on the phone. They didn't want to provide the medical records. I tried to get letters from the doctors, but the nursing home itself would not provide me with the medical records.
The question I have is, let's say, the social worker at a rehab facility says you have to leave. You're not making enough progress. It's not going to cover. You decide you want to set up a meeting with the head of the whole rehab. You go to the CEO. You cry. You make a plea. If the head of the rehab feels sorry for you, do they have the ability of letting you stay?
Normally what happens is they'll indicate to their patient or their client that they're going to have to pay this much per day. But the way
but I'm saying if they say, you could stay, we're going to advocate for you for Medicare.
They do it sometimes, but after it's denied like 2 or 3 times, it's like, okay, you got to pay and bye-bye. But the thing is, you can fight it, and you have to fight it. And the way to fight it is you've got to get the letters from the providers to indicate why you can't go home, okay? Between that, they might ask for the medical records too. But as long as you get the letters from the doctors, normally it's overturned.
That is great. And a lot of people don't realize how to get it overturned.
Right.
And who do you appeal to?
Well, the case for the $24,000, I appealed to the Attorney General, and I also appealed to the insurance company. I'm known by most of the executive office of insurance companies throughout the United States.
If somebody has a problem and if they reach out to the Attorney General's office, does the Attorney General's office ever advocate for individuals?
Yes, but the thing is, I hate to say this, sometimes you might have to call them a few times. When you apply online, they usually give you a case number, and you'll contact them again with the case number. But there are issues where I'm having problems because they don't want to speak to me. They want to speak directly to the client. I had a case recently. It was $600,000, and I overturned it. It was a small insurance company, a regional insurance company in the state, and I saved his wife over $600,000.
Wow.
And it was referred to me through an attorney.
That is really amazing. Are there any other cases that you would want to highlight?
Well, if you ever are in a situation where I see this happening a lot now. People they go to the emergency room, they're accepted by the hospital, and then the insurance companies turn around and say, it wasn't medically necessary. We're not going to pay this. And then you have to prove that it was medically necessary.
Wow.
I have a friend, when she was 40 years old or 44 years old, she goes into a hospital. I said to her, look, we got to make sure that they're going to, put you as an inpatient. She even had the CEO. She was there for a week. When she went into the hospital, she had one diagnosis. The middle of the week, they gave her another diagnosis. She calls the CEO in, don't worry, don't worry. 2 weeks later, she gets a bill in the mail for $44,000. And I told her what to do, and the case was overturned.
Wow. We have to take one more break. And my name's Paul Feiner. I'm the Greenberg Town Supervisor. My guest is Adria Gross. Could you tell us how people could reach out to you again?
Adria at medwiseinsuranceadvocacy.com or go to www.medicalinsuranceadvocacy.com. My phone number is 845-978-9493. Thank you.
Great. Paul Feiner. We'll be right back.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner, Greenberg Town Supervisor, and I'm talking with Adria Gross, and she has an advocacy group called medicalinsuranceadvocacy.com, and she helps people who have been denied long-term coverage care that people thought they had, but it turns out the rehab facilities, nursing homes don't want to honor it. I have a question. Normally, if somebody has, say, a Medicare Advantage plan and they think they're going to get rehab coverage, how soon after they're in a rehab do the rehab facilities try kicking them out?
I'm happy you asked that question. Believe it or not, it happens so often within 2 weeks to 4 weeks. And many of those people, I remember overturning a case for a hospital in New York City, and the woman lived in Staten Island. She couldn't go home. She couldn't walk up those stairs. She was there for about another 2 more months. And believe it or not, we went before a judge, and the case was overturned. But I'm just shocked at what goes on with these Advantage plans. I mean, I used to work for 2 insurance companies. I saw what went on. I mean, I remember a case where someone was supposed to get paid for disability. It was $1 million. Not only did that insurance company wait 2 years, they sent out a draft to the person after 2 years and said, we'll pay you in 30 days. So that was 25 months they had to wait.
In terms of when the appeal process, does somebody how do they evaluate patients, and who evaluates the patients?
So what normally happens is when they're in a rehab, they have different therapists. They might have a speech therapist, occupational therapist, physical therapist. And very often what I see in the cases is like that one in Staten Island, she had a long staircase to get into her house. There was no way she could go home. And what happens is even the people, when they're in the rehabs and they can't walk up those steps, there's no way they're going to be able to get home. For that reason, they still are pushing them out because the commercial insurers are saying, we're done. You don't need it anymore. And when we can prove, the letters that I usually get are from the physical therapist, the occupational therapist, the speech therapist, and very often from the doctors. And even with the doctors, I've done this with long-term care policies that have been denied, and also the nursing facilities. You need letters from all your doctors. And if they can prove in that letter that there was no way for you to go home, it was impossible, and you're able to prove that you can progress and you're getting better, because I've seen it even with strokes. As long as you can prove that, normally the cases are overturned and they get paid.
That is very positive. Are there any insurance plans that, are pretty, good that you won't have these problems? If somebody wants to sign up for like a Gold Star standard insurance plan, and if they said, I just don't want to have the stress because, when I'm 103 years old, I may not have the ability to really fight something. I just want to know that I'm going to get the coverage.
People ask me that all the time, and I wish I could identify which insurance company. So one thing I have to say is, look, we have 2 major insurance companies out there who sell the majority of the insurance, and then you have a couple more. So, I don't get too many claims from one of them because they don't sell as much as the others.
Right.
But I have to be honest with you. I would never trust them. I would never trust any of them. And that's the reason why, people say, hey, Adria, you're helping all these people out there. Maybe an insurance company will hire you to take you away, to bring you back. And I have to be honest. I'm scared myself if I wind up in a hospital. Are they going to pay for my bills? It's very bad. And I mentioned this earlier, what's happening with the insurance companies. You go in the hospital, you go to the emergency room, they admit you to the hospital, and then the insurance company turns around and says it wasn't medically necessary. Well, you know what? That's insane. Why would they even take you into a hospital to begin with?
Right. I think I'm going to send this link to this interview to our Attorney General, to the governor's office to state legislators, members of Congress, Attorney General. I have a question. If you were elected, if you were an elected official, what could Washington or Albany do that would protect the elderly? I mean, is there any legislation that they should be considering? Because this is like horrible. You know, I've seen people crying, because they've been kicked out. People don't know what to do. People don't know how to appeal. So most people probably are told that they have to leave, and they leave, and they don't know what their rights are, where it's too complicated.
Believe it or not, people have asked me to run for office, and I will not do it. I mean, the fighting that you see between the parties is crazy. Okay, I really can't take that step. But the only thing, and I just want to tell you, before I came to your show, I just responded to someone who was writing about the veterans, because even the veterans, I have another book coming out, and here was a veteran who fell off a building, and he needed back surgery, and he could not get it from the government. So I wish I had kinder words to say, but what I would ask of the government is to please help the people. You want to get your votes, please respond to the people and help them, because it's not either party. I see it all over.
But is there like legislation that you could see? Like if a senator or a congressperson or a legislator or the governor want to do something, is there anything that they could do that would change the system?
I think that one of the things that would be helpful is if they had a large department within the state and the counties to help people who are in this situation.
So basically, what would be great would be to have people almost doing what you're doing.
Right.
Because not everybody will know of your business and the services you do, but the county offices of the aging, local offices of the aging, they could be they could be advocates, and then let people know,
right,
that this is a service that they could provide,
right,
and they could really publicize also the problems that people are having.
Right, right, and there are some counties that offer this, but it even gets to a point where they give up. They don't know what to do, and I've had people come to me who've been in that position.
Right. The other thing is that a lot of time when you're dealing with government, sometimes you get a phone answering machine, and you really have to be passionate about wanting to help people, because it takes a lot of time. It's sometimes complicated. You have to be persistent, and it seems like you have the passion that you really want to help people.
Well, I tell people all the time, don't give up. Some of my cases take 2 years to overturn. And most of the cases that I have are all overturned.
So if they were overturned and it takes 2 years, what do the people have to upfront the money while the case is being appealed?
I tell people, don't pay, don't pay, don't pay. And I always tell people, if they're going to send you the collections, call the collection agency and tell them, I'm working on this case. And you can identify who you're working for. And usually, it can't go any further.
So would a rehab facility kick you out if you're not paying, or if you're still in appeal?
They're going to say, you can stay here, but you have to pay. If they're even willing to tell you you've got to pay.
Right. So unfortunately, we ran out of time. I'm Paul Feiner. And again, how do they reach you?
My phone number is 845-978-9493, or go to my website, www.medicalInsuranceadvocacy.com. Thank you.
Great. Thanks a lot. I really appreciate your time, and good luck.
Thank you.
Great. I'm Paul.